Grandparent adaptation. New parents need to recognize that grandparents contribute to the family. This new baby, having that relationship from the grandparents to the parents to the new baby contributes to family continuity, and that intergenerational relationships do shift. However, their involvement depends on cultural and familial factors. So they play a very important role, but sometimes it can be a role strain with, a new mom wanting to take care of her baby, do everything on her own, and then, when they reach that postpartum blues, then they reach out for help, but parents don't necessarily do things the way the new parents expect, and, there can be some strain on those relationships. But the grandparents' main role, their primary role, is to support, nurture, and empower their children in their new parenting role. Grandparent classes are a very good class for perinatal education for them to attend. That's where they get up-to-date information on childbearing and safety. For instance, 1 generation, 2 generations ago, babies were placed to sleep on their stomach. They didn't, car seats were not as important. They did not rear face for up to 2 years, the way the American Academy of Pediatrics recommends now. So by them attending classes, it helps them, everybody be on the same page. This picture is so sweet. Again, this is one of my favorite parts of being an OB nurse, but just the interactions between new parents and the baby. But this is a new mom holding her infant in the in-face position. So nursing care management, this is really pretty straightforward. What nursing actions that you can include, providing opportunities for parent-infant interaction, implementing those strategies to facilitate sibling acceptance of the new infant, and just including them, yet recognizing what an important big sister and an important big brother that they are, and what their roles can be to help. Teaching them to be gentle with the baby, where to touch the baby, where not to touch the baby. Provide practical suggestions for infant care. There's the perfect world, and then there's you're going to be so tired and desperate for sleep that you're going to do anything to get sleep. So as far as practical guidelines, an example could be babies are supposed to sleep alone on their back in a crib. But parents can get just so desperate for sleep that sometimes they put the infant in bed with them, which greatly increases the risk of SIDS. So, you can teach them ways that, putting a bassinet in their room right beside the bed where they can put their hand with the baby. You can teach them ways that how to cope, and what some examples of just when you're totally exhausted or when the baby is crying, how to prevent shaken baby syndrome. Just, being very realistic in education is actually the best way of preventing any harm to babies and helping the parents deal with it. Provide anticipatory guidance on what to expect as the infant grows and develops, including sleep-wake cycles, interpretation of the infant behaviors, quieting techniques, infant developmental milestones, sensory enrichment and infant stimulation, yet not overstimulating them, recognizing signs of illness, well baby follow-up expectations, and then an immunization schedule. So a lot of that, we will cover part of that when we get into newborn, but also some of that you're going to get from your peds class also. So this is where, your classes come together very well. Additional nursing care management, provide positive reinforcement for loving and nurturing behaviors with the infant, and closely monitor parents who interact inappropriate or in abusive ways with their infants, and notify appropriate mental health practitioners and professional social workers. Believe it or not, you can pick up on some negative and abusive behaviors in the hospital setting. It's also important to know the history. Do they have custody of previous children and that type of thing? But you can really pick up on a teenage mother who was hoping for a girl and they had a boy and they're not interested in the baby at all. Or I mean, you have moms that refer to their infants when they're in labor. I mean, it's just terrible terms, and you think, how's that going to be after the baby's born? Or parents that think when their baby cries, it's to be to despite them, and really that babies are just crying because they have a need that needs to be met. So, believe it or not, this does happen. It's very sad, but as a nurse, you can intervene very early and help teach them or get that baby placed in protective custody. Here's a picture of a new sibling meeting a new baby for the first time, and you can see when they call, a toddler like this a big brother or a big sister, they don't fully understand it, but you can see them, this older child touching the baby and rubbing their head and smiling. So you can help teach during instances like this. And here are your key points. And lastly, here is our practice question. 4 hours after difficult labor and birth, a primate refuses to feed her baby, stating she's too tired and just wants to sleep. What should the nurse do? A, assist the woman with initiating breastfeeding and remain with her as long as necessary. B, recognizing this behavior is taking hold stage. 3, record the behavior as ineffective maternal newborn attachment. Take the baby back to the nursery. Reassure the woman that her rest is a priority at this time. So the correct answer is A. The new mother is in the dependent or taking in phase. She needs to rely on others to meet her needs for comfort and nourishment of her infant. By assisting the mother with lactation and remaining close, the nurse is nurturing the mother and fostering optimal care of the newborn. So even though she is just so incredibly tired, you're there to support her, but also meeting the needs of the baby. And the phase she is in that dependent or taking in phase.